Pop quiz number 34. The nurse is ambulating a cardiac surgery client whose heart rate suddenly increases to 146 beats per minute. In which order will the nurse take the following actions? 1. Call the healthcare provider. 2. Have the client sit down. 3. Check the client's blood pressure. 4. Administer as needed oxygen by nasal cannula. Okay, guys, this is what you're going to do. The first thing you're going to do is number 2, have them sit down. Whenever something is harming or injuring your patient, the very first thing you do is stop whatever's harming or injuring the patient. So the first thing you're going to do is have them sit down. The next thing you're going to do is number 4, give them oxygen as needed. After you stop what's harming them, you want to make sure you keep them safe. You keep them alive. You keep them healthy. That heart rate is increasing. Why do you think that heart rate is increasing? Those tissues are screaming for oxygen. That oxygen is being carried in the blood, so that heart rate is increasing because the demand for oxygen has increased. So after you stop what's harming them, you're going to give them the oxygen as needed. Let's keep going. What's next? Number 3, after that, you assess your patient. You stop what's hurting the patient. Give them oxygen if needed. And the third thing that you're going to do is assess them. Check the blood pressure. Look at those vital signs. And last, you're going to call the healthcare provider because guess what? You have to have something to tell the healthcare provider, right? So you're going to tell the healthcare provider what happened. You're going to tell the healthcare provider what your assessment was. You're going to tell the healthcare provider what you did for the patient and wait for orders.